Hi folks, it's Tracy here at Home Care by Design. I'm the president and founder of this private duty non-medical home care agency in West Lafayette, Indiana. I wanted to tell you some really exciting news, and this is really great news. In the history of all of Medicare Advantage, they have never paid for private duty in home care. So consumers had to pay for that out of their own pocket. And of course, some people can afford it and some people can, or some a little and some a lot. But now Medicare Advantage has made the announcement that they are actually going to be paying for private duty, non-medical, in-home care in the privacy of a person's home. I mean, really, when you get that one-on-one quality in your home, there is no better care because you can't get one-on-one care anywhere. And they've really found that when you have that care in the home, that the person is going to stay well for longer, they're happier, they're healthier, and that drives our health care cost down. And that's a huge win for all of us in the nation, no matter where we live. That's very, very important. And if somebody's coming home from the hospital, they don't want to go back to the hospital. And sometimes that can happen in the healthcare world if somebody's not, checking on them and have, systems in place to be able to support them coming home, making meals, medication reminders, picking up medications, staying with them if they need somebody, assisting them with bathing or dressing or medication reminders, whatever it is they need. And you could see they could end up right back in the hospital, which is super expensive. The hospitals get penalized for that and don't get paid as much as they should. So it's all of these things coming together because the government has realized that home care is the most high quality and affordable option that is available. And so exciting stuff, guys. So Medicare Advantage, I'm going to put the article on our website so you can go and look at it. It's going to be starting sometime in 2019. I don't know exactly when they haven't announced that yet, but I'm looking for the information. I'll be keeping you posted and keeping you updated as we hear that. And here is the thing, how does this impact you? Well, if you are a family member, you are an older adult, a senior, you've ever needed help before, you've had hospitalizations before, you've had any kind of falls, those are kind of the key things, but there could be many others. You have certain diseases like Parkinson's, Alzheimer's, stroke, dementia, congestive heart failure, diabetes, cancer. There's a number of things. These are all signals that get a backup system in place, because here's what's going to happen is there's only so many home care agencies and there's only so many caregivers, and there really is a big caregiver shortage nationwide. Now that's going to be a little bit of a hiccup, and so I'm interested to see how we're going to figure that out, but I know we will because we always do. As a country, we'll figure that out. I'm believing for the best. But I know for our agency, we have a limited number of people that we can serve in order to still do great quality. So what's going to happen? And that would be the case with any agency. I mean, honestly, you don't have just unlimited numbers of caregivers because you couldn't train them and oversee them and supervise them and coach them, or you couldn't even manage that many of them and do it really well. So again, there's a limited number of caregivers that are out there. And so when you need help, if you wait until after this is already implemented, there's going to already be thousands and thousands just in our local community that are now going to be eligible for those resources that didn't have them before. So what that means to you is you pick up the phone because now you need some help, or you're an adult child and you live in another state and you were home for the holidays and you see that mom was needing some help at home, and then you get back and you give us a call and it's like, we have a waiting list and you need it now. Because a lot of times, most of the time, things in the healthcare world or the senior care world unfortunately ends up being because of a crisis. Now, Home Care by Design is the only company that we have special membership programs and things that we have put into place to start taking the crisis out of the crisis. Because when somebody does have a hospitalization, a fall, a surgery, any of those things, God forbid, a stroke, a heart attack, any of those things, but they can happen. You want to have your backup plan. That is not the time to start doing research for a home care agency. That's not a time to start, shopping around and getting prices or learning about it. It's just too late. I mean, you can do it, but you're probably not going to be as happy because that agency's now got you in a case of an emergency, and they already have their own regular people that they're serving, and so now it puts them in an emergency to try to get in the staff and on the time and get them trained in your particular case. And there's a lot of moving parts that people don't always understand in order to make that magic happen. So we have, so when in our program, and again, we're the only ones that do this, and we set it up so people can have a membership, and they can have different levels of membership that they opt into, either very small packages or higher packages that can even include home maintenance services and access to our clubhouse. We are also the only agency that has our own clubhouse because we want people to get out and be able to do things just like they would if they lived in a beautiful retirement community. They'd be able to go down to parties and activities and events. Well, we have that here at our clubhouse, but the great thing is the person never has to move from their home. They can just access it, or we can go pick them up or whatever when they need it. So these are some really great benefits. So you can have a package put together with a number of different things because we really tailor it to you. That's why we're called Home Care by Design. We really tailor those packages and those services to you, but you have to come in early so that you can get them. You know, I do look at it, it's like insurance, because it's not a matter of if, it's usually a matter of when that's going to happen. And just like if you had an accident in your car, and didn't have insurance, you wouldn't be able to go purchase insurance and have them pay for it. You know that doesn't work. It has to be, you have to have the insurance before you have the accident, so then you can get the benefit of that insurance that you've been paying into. So our program looks very, very similar to that, so keep that in mind, because I want you and my community to be able to miss the large group of people that's going to be coming in and going to be needing these services, and I want you to get a jump on it. And it's also going to help our agency because we would like to get to know you and your family a little bit before all of this comes out, because it's going to get really, really busy. And here's the thing, in the fall and winter, that's the busiest time in home care and health care anyway. So we're going to be busy with just our busy season, and then we're going to be busy because people are ramping up for this 2019 where more seniors are going to be coming into their agencies, and I want you to get signed up early. So if you'd like more information, I'd love to share it with you or somebody here on my team. Go to our website first, and I want you to look at that article because it's really, really good, and it explains more. You don't just have to listen to me. You can just see what the article says and do your own research on it, but it is exciting news. So go to our website, and you can also fill out a contact form on our website, and our website is homecarebydesign.com. Or you can come into our place. We are the only place that has a beautiful, lovely campus that you can walk into, and you can visit with the people who are going to be in the home or caring for you or your loved one. And it's really great because you get to build a relationship with us, and it's not just in your home when we're doing services. It's wonderful, and it's worked out just beautifully over the last couple of years. So come on by. Our address is 917 Sagamore Parkway in West Lafayette. If you can, set up an appointment so that we can be prepared. If you really want to talk about this, then we can really sit down and we can do what we call discovery, find out all the things that you want and need, kind of get a history, and then help put together a reasonable, sensible package that's really going to help you and your family have the peace of mind that you want and you need for if and when these things happen. Or you can call us at 765-464-8080. I encourage you to do it very, very soon. Again, the fall is up on us. We're already going to get busy with regular business, but this new Medicare Advantage paying for non-medical and private duty home care is going to have a big impact, and I want you to have the care that you need if and when you need it. So prepare in advance, because home is where the care is.